Jamaica, December 15, 2021. 21 months after the first recorded COVID-19 case, we traveled to 3 parishes to hear firsthand from those who were impacted by the pandemic. 3,194 persons across Jamaica took part in a 2021 study commissioned by the United Nations Development Programme UNDP. Their responses, combined with secondary research, is helping us understand who was impacted by the COVID-19 pandemic. In short, who is really vulnerable in Jamaica. Orakabessa St. Mary, December 16, 2021. The study found St. Mary was the most vulnerable parish, closely followed by St. Anne and Manchester. Compared to other parishes, St. Mary was most vulnerable in terms of its access to health centers, income, food quality, and social protection.
This parish is on the coast. Most of the employment opportunities are on the coast. So tourism, entertainment, and farming, those areas, the parish depend closely on those sectors. And as you would have seen, those are greatly affected by COVID. COVID has affected businesses where they have lost revenue. For example, the popular St. Mary producers, they were greatly affected by COVID as it relates to their export. That was greatly impacted.
In terms of the health center for Bonnygate, it basically offers a postnatal and prenatal service. So it basically operates only once per month to cater for those mothers.
St. Anne's Bay, December 17, 2021. Comparatively, St. Anne was found to be vulnerable in the number of positive COVID-19 cases, disability, and school attendance.
For the young ones in school, especially the blind and especially the persons who have learning difficulties, with the closure of schools, the lack of participation, not able to become involved, just as many as you know, with their able-bodied counterpart, children to go to school and to work in the virtual space online. That's very, very challenging and difficult for them, not having the devices, and you know, it's a big, big challenge for our children in their education. Economically, many of our disabled persons, they are self-employed, and some of them, they are dependent on various organizations in order to get help. And those who are employed at times, you know, experience that kind of difficulty financially. So therefore, they have to depend much on care packages that has been handed out, depended upon financial packages that might come from our local own governments. And not everybody are able to get benefits.
All the personnel who worked in the hotels was laid off based on the lockdowns that we have. So it must have a serious impact on the economy at St. Anne. I operate a gas station, and my sale went down by 66%. So I had to furlough workers with that. And during the lockdown period, if you could see it within my area where persons, businesses closed down early. So the streets were virtually empty. All those other activities, that parties and things that people used to generate income, they weren't there.
When COVID happened, I was working on a farm, and then in 2020, COVID cases started to pick up and things started to get worse. And the boss, she said that she had to lay us off for a while because the produce was not selling as usual and she don't have the income to pay us anymore. Because I was a woman, I was impacted in a say a negative way, because I wasn't able to do as much as a man would do. A man would be able to run behind the cows and spray them and carry the heavy stuff and so on. What we were doing, men could do it as well, so we were laid off.
Mandeville, Manchester, December 19, 2021. Compared to other parishes, Manchester was most vulnerable in terms of access to health services, well-being, food consumption, and school attendance.
Kind of rough, not really managing so far, because the pandemic is kind of rough. Before the COVID, the food was kind of reasonable, but now, to the pandemic, it is very hard. Everything raised up. We are not doing fine because things that we used to buy, we can't buy it anymore. We have to cut down to buy other stuff for the children them, because they have to go to school, so we have to buy different stuff for them to go to school. So like sometimes food stuff, we don't really buy them so much.
We've been hit hard as a parish by the COVID pandemic in every sector. And it came at a time when there was a downturn in the bauxite activities in our region. So we lost a lot of jobs prior to the pandemic. And then the fact that it's an agricultural parish, with the closures of the hotels and the education, every sector has been impacted, and more so our parish here. So people have been scrambling. All of the residents have been scrambling to survive. Where we have a problem is that imported proteins now, and the price has been escalated and stuff like that. Because we're an agricultural parish, there's a slight cushion as it relates to food security.
The study, conducted by the Caribbean Policy Research Institute, CAPRI, and the Sir Arthur Lewis Institute of Social and Economic Studies, SALISIS, scored vulnerability using UNDP's Multidimensional Vulnerability Index.
The Multidimensional Vulnerability Index, or MVI for short, is a measure of the many layers of vulnerability that households experience in the aftermath of crisis, natural hazards, conflicts, and other disasters.
In this UNDP SALISIS Capri study, we assessed a number of issues. We explored well-being, education, health, the economy, livelihoods. We were looking at persons' experiences with the measures that were introduced, the protocols, and how the COVID-19 impacted everyone.
The focus was on getting to identify persons or groups who would have been made vulnerable in the context of COVID. Whilst we would have an understanding generally of vulnerable groups, we wanted to see, did COVID impact particular groups in ways that we may not have known or been able to just, understand without having the surveys.
In order to determine the impact of the COVID-19 pandemic, we focused on what were the issues first. After that, we tried to determine where the issues were and the magnitude. And this was done across a myriad of sectors, various segments of the population, and across different social dimensions such as welfare and mental health.
More than half of the people surveyed said the COVID-19 pandemic has taken a toll on their mental health. Respondents reported feeling more depressed, worried, anxious, or stressed as a result of the pandemic. The COVID-19 pandemic also brought to the fore the many issues facing Jamaica's social protection program.
So we found that prior to the pandemic, the social protection program in Jamaica was inadequate in the sense that there were segments of the population which were being left behind as there are persons who are living below the poverty line, which did not have access to the main social protection instrument in Jamaica, which is the PAP program.
We are trying to get the kids them on part, but each time we go there, they say that they're going to come to the house and we haven't seen them. Without parts, it affects us a little bit because sometimes we don't really have it, but with parts, probably it would be more better.
Women, youth, and informal workers were most severely affected by the economic downturn caused by the COVID-19 pandemic.
For women and men, although they both lost jobs, we found that men were able to more quickly pick up jobs in the labor force than women were.
So, what are some policy recommendations to help reduce vulnerabilities?
It is very important that we leave no one behind in moving forward. So greater measures need to be taken to strengthen the social protection system in order to ensure that the most vulnerable segments of the population are included.
I would love to see a public health system where persons who are disabled can feel comfortable to get to a hospital, get to wherever to access health care quite easier and with a level of independence and security.
I would propose that we use this pandemic to revisit our economy, our pillars of our economy.
The full publication of the 2021 Socioeconomic Impact Assessment provides more in-depth analysis and insight into the effects of the COVID-19 pandemic on Jamaicans. The study can be accessed at www.jm.undp.org.